Why are physicians slow to respond to this? Well, as you know, they want peer-reviewed studies, and they're limited. This is a major paradigm shift for allopathic physicians like me, because we're not trained to go out on the periphery and the edge of science. We want mainstream. We want to know that all of our colleagues are doing the same thing. But I'm so far away from that now that I have to be careful I don't end up on some other planet, because I just think the model's wrong. They're in this disease management mode. You know, when we're managing people, it's very easy as a primary care doctor to see somebody with heart disease, because I know exactly what their cholesterol levels should be for their risk factors, and I know exactly what medications to put them on to manage those numbers, so that now we're doing what the standard of care says. But the evidence to me is not convincing that by managing people with those levels that I'm going to prevent them from having a heart attack or a stroke. And when I was in Washington, there was a physician next to me from Missouri, a really good guy, really good physician. And I asked him, how many patients are you seeing a day? He said, 30 or 35. I said, how much time do you get to talk to him about disease prevention? No time. I don't talk to him about it anymore. I said, why not? He said, because they don't listen and I don't get paid to do it. And unfortunately, that's where allopathic medicine is, at least for primary care. We have a problem, and we have to help physicians get out of that mindset of managing diseases. Okay, we're also afraid that our peers are going to judge us, and that if something happens and we end up in a court, if we're not following mainstream medicine, we worry about legal repercussions. And for all of us, anytime we change our paradigm, that's pretty scary. It's very uncomfortable. Okay, so here are some of the things I've heard from physicians. Water is just water. It's not just water. The Nobel Prize 2003. They said that the body has 3 buffering systems. You don't need to use an alkaline water to buffer when you already have 3 buffering systems. Yes, you do. Because even though we're all alkaline, your blood is slightly on the alkaline side. If you're not eating a healthy diet and leading a healthy lifestyle, you're going to be on the acidic side of that alkaline range, not on the alkaline healthy side of that narrow range. I've heard one physician say, why don't you just take baking soda? Well, I don't know what baking soda is going to do. It's certainly not going to penetrate cells like the alkaline water will, and it's not going to provide you any antioxidant protection. Some say, well, you drink that alkaline water, it's just going to be neutralized by the stomach acid, and that's not true, because stomach acid is not secreted until you stretch it with food or you put protein in the stomach, and that's the way it's intended to operate. So if you want to get the benefits of alkaline water, drink it in between meals. I don't even think there's harm in drinking alkaline water at a meal, but I would prefer that we all try to drink it in between meals when our stomach is empty, because it's quickly absorbed, just like alcohol is absorbed directly from the stomach. Is this the next wellness or hoax, wellness fad or hoax? It's not. There's research and there's plenty of support to show that this is going to impact healthcare in a major way for those physicians and healthcare providers who have an open mind. They want to see data. Well, I've provided 28 abstracts. I don't know how much more data you need.